Hey everyone, good afternoon. Welcome to our webinar today, topic on how to optimize your clinic's efficiency. We are going to be doing things slightly different today because we're also testing this new webinar setup. Hopefully in the near future, we would love to live stream this webinar to YouTube and to Twitch at the same time. So if you guys haven't met me before, my name is Alfred Wong and I'm the Chief Operations Officer here at Cortico. Our topic today, our hope is to empower you with some tools that can improve your clinic's efficiency. Now, some of the tools and methodologies that we'll be speaking to today might not be new to you, but our hope is that the way that we've implemented these tools and solutions might lead you to have some creative ideas on how it could be applied to your practice. A couple of administrative things to go over before we begin. First off, this webinar is being recorded and the recording will be sent to all the registrants of this webinar before, I'll say early next week. There's probably some modifications we would like to add to it. But all the recordings will be made available. It would also be uploaded to YouTube and would be made available, which I would also suggest you to check out our YouTube channel, as we have some really great content there covering a couple of topics, as well as all of our prior webinar recordings. If you have any questions, feel free to put it into the chat. We have a team here that's looking at the chat and we will strive to answer all your questions. If not during the presentation, we will address it into the Q&A. And speaking of Q&A, the feedback that we've received from our prior webinars was to allot a little bit more time on the Q&A. So we're allotting for 20 minutes for today's session. If you have any questions or have any ideas, feedback, please email us. I'm going to put in Ashley, our clinic consultant's email up on the screen here. So please feel free to email or respond to our emails and recordings that we'll send shortly. So with that, I'm going to begin and introduce the team here. As I mentioned, I'm Alfred Wong, the Chief Operations Officer at Cortico. We have Ashley here, our clinic consultant, great extensive history working with clinics and managing clinics. Clark, who is our technical co-founder at Cortico. And we also have our repeat guest panelist here, Adrian Sarsinski, who is a clinic manager and Oscar developer. So with that, I'm going to pass the screen share to Adrian. Adrian, let me know if you're able to screen share.
Yep, sorry, just, okay, here we go. Perfect, so today we're here to discuss exactly how to optimize clinics' efficiency by 50% using 3 powerful tips in which Cortico can assist with as well. To start off, we've noticed a lot of important feedback that we received from the different surveys and pre-webinar registrations that we've had our guests fill out. And we've seen these different things that you're spending a lot of time on that you'd like to reduce, including phone calls burden, new appointment scheduling, entering information, and repetitive tasks such as managing no-shows and booking follow-ups. So today, Cortico is here as well to show you how we can help you fill up doctors' schedules using the different tools that are available to you with the platform and in other ways. For example, with Cortico, the patients can book various appointment times online themselves in customizable workflows set by the clinic or the doctors. An example that we see common is right now during COVID, doctors are offering phone and video visits Mondays at a specific time. And as well, we have different combinations. You can make your own such as phone, video, and in-clinic visits Tuesdays from 1 to 3. As well, we can accommodate as many workflows as you need for many different booking scenarios. And Cortico does not force the clinic's schedule to change. It adapts to the existing workflows and systems that you have in place. So let's see a quick comparison. So with a clinic that has Cortico, you will see on the right and the different things on the left from a clinic that does not. So some common things that we see, this was actually the #1 survey response, was the incoming phone burden. So MOAs and clinic staff are complaining the most about managing incoming calls. The #2 thing was getting patients to fill out forms and questionnaires and update information repeatedly. That was actually #2 with a huge amount of responses as well. So I'm sure you're familiar with patients sometimes crowding the waiting room, having phone burden, manually entering all their data, managing these different no-shows and photo collection, and asking patients to send you documents. The ways we can help you efficientize your clinic, make it more efficient, include by employing the self check-in and registration terminal system, which we'll go into detail about in just a minute, as well as the different efficiency tips, as well as online booking, self-registration, and updates, so patients can update their information by themselves without needing to take up your time, and book, cancel, confirm, and look up appointments online, as well as receive information such as pertinent photos or forms to fill in the patient portal. A frequent complaint that we've gotten is when patients are asked to book online, many systems, they force them to create an account. So the patient has to sign up an email, sign up a password, get some verification code, go through a whole bunch of registration links, check their email for spam, folder for links, different information, just to book an appointment with their own doctor. Well, we've noticed this, and Cortico was actually specifically designed to avoid this sort of workflow. So we maximize usage by employing easy sign up and registration, so patient does not have to enter a password or some verification code. And for this reason, patients such as elderly people really appreciate this and use it every day with ease. And it's actually not only elderly patients. Think about families. A mother who wants to book her kids in with a doctor, and they all share the same email address, or they have 2 email addresses. Whatever it is, it's confusing to have to create a login or some sign up for each one of these patients. So with Cortico, the mother or whoever needs to book for someone else in their family, they can just enter their health card, date of birth, verify their information to proceed with minimal burden on them, maximizing the usage to make it much more efficient flow. Patients do not need to worry about remembering passwords with Cortico. That is not secure, prone to hacking, and we employ methods such as asking the patient for their personal health number and date of birth, and also patients who do not have a health card are accommodated, such as private pay patients, out of province international patients on other insurance plans. It's all customizable, and it was designed this way to maximize their usage. The #1 thing that's probably on many doctors' minds right now, as COVID is kind of winding down in some places, is patients coming back into the office. I've heard myself a lot of questions on doctors reaching out to have their phone system, their check-in terminal, computers, things in the office back to the level they were before, or even better. than before COVID, because right now patients need to be able to accommodate their own check-in and stop using up all the time of the staff that they are accustomed now to getting all their things done online. And with Cortico, we offer a check-in terminal, which is very intelligent, because you can see right on the right here, there is a picture of this check-in terminal. And all the patient has to do is, if they have a health card, enter their health card number. And if they have an appointment, it will prompt them just to verify their information. A lot of times they switch phone numbers, addresses, emails. So they have to verify that it's all correct. Then the patient has to agree to your clinic policies, which is nice for compliance reasons, and to have a much more organized clinic so everyone's on the same page. And finally, they get marked as here on your schedule if they have an appointment. Now, they also get to complete intake forms, consent, and different things during this process, and they are queued appropriately. For patients who do not have a health card, this is a very common question that we get is, does the system, including the check-in terminal or registration terminal, it's actually all in one, accommodate patients without a health card? Well, the answer is, of course it does. So it's designed in a way so that patients without a health card, they can enter their date of birth, email, other identifying information, and check in or sign up appropriately. Now, a question also is, do we have to be forced to accept walk-ins with the terminal if we have one? The answer to that is no. Every clinic who has this check-in terminal can either select whether they want to accept walk-ins, so allow new patients who are not in your system to register and have an appointment time slot and be seen, or you can select just to have existing patients on the schedule for today register and update their information and be marked as here on the schedule. So if your clinic does offer walk-in visits, as mentioned, they can be configured to sign up. Patients can sign up on the terminal themselves. Their demographic in the EMR system that you use is automatically created with the patient's information. The patient is asked to update their information if they're already a patient in your system. And they are prompted to put in the reason for visit. Much more frequently now, patients are comfortable with putting that into the iPad, actually more than giving it to someone like a staff member. And lastly, the patient, if they're a walk-in and if your clinic allows this sort of registration, they get added to the walk-in doctor schedule and they get marked as here on the schedule so that your staff doesn't have to ask who is who. And when you're ready, you can call out the number the patient gets queued for or their name. Now, something that I've heard for many doctors is that they're getting these notification emails from college or somewhere like OCFB, and they're recommending more in-person visits. Now, Cortico does not force any sort of, it adapts to any workflow you have. However, just to point out, physicians right now are getting their clinics ready for more visits and trying to save more time with these and make them more efficient so that it's as efficient as some phone visit or video visit and it doesn't have a big impact. For example, in Ontario, most virtual care billing costs are getting significantly reduced or removed on many different levels. There's been many changes that are upcoming, and many doctors I've heard are just saying that instead of dealing with this complicated burden, we're just going to focus a bit more on in-person. So with this in-person, they're going to have more queues of people waiting inside the clinic. And we're here to help with how you can make that more efficient and much more easy for your staff and your clinic workflow so that you don't have people waiting and constantly bugging for wait time. So a nice unique feature that is offered with this solution is the queue management. Patients can check in on the kiosk and have their place in line tracked on the queue system. So your clinic may already have a monitor or a TV in the waiting room. I've seen most clinics have some form of this. So you can configure that just to go to a special link provided by Cortico that will show the now serving. So that's which patient is waiting to be seen next in the exam room, and the number of patients waiting. And this can be easily adjusted by staff, and it's automatically managed and updated by the check-in terminal. So just to briefly explain, this is an easy way to lessen the number of people waiting inside your clinic, because the patients can visit the link posted on the clinic website that shows exactly the number of patients in front of them and who is being seen, so that, for example, they can go to a coffee shop or take a walk outside instead of waiting and constantly asking or waiting to be called. They can just look at the number who is next, and when their number is approaching, they can come back to the clinic and be seated in time. So that makes it actually much more efficient. Now, if you have any questions about this check-in terminal or queue management, I have free consultations available, so I can sit down with you for 30 minutes and go through all of this and make it exactly a plan how to have your clinic onboarded, or give you an idea how we can make this work. I have actually 5 time slots next week. If you'd like to contact me, email is adi@aditech.ca. That's ADI@aditech.ca. We'll put that in the chat. And regarding this queue management once more, this frees up significantly your waiting room space. I understand this may be confusing, or it may seem overwhelming sometimes, all these different things. How are we going to implement them? How is this going to get the patients to work? Are they going to like this? Well, you can rest assured that this has been working in many clinics. I'm actually also a part-time clinic manager. I manage a clinic which has a workflow full of walk-in patients, family physician, specialist, as well as an after-hours clinic. And I've seen how this can actually improve on firsthand. This is not just something that is arbitrarily out there. This is real, and it actually benefits you. And we're gonna give you some numbers on the next screen for this. As I mentioned, the #1 complaint we've had is that the staff are having too much incoming phone volume. The phone is constantly ringing. That's definitely something that is not efficient, and it takes up time from the MOA, whoever answers the phone, from other tasks that they can be doing that are much more valuable for the doctors and the patients. For example, with Cortico, the patients can actually book online, confirm, cancel, and do all of these things online, so that those who actually need to speak with staff, or those who do not have, rarely cases, those who do not have internet, they can actually get through without waiting 1 hour or getting the busy tone because the lines are full. So it actually doesn't force you to adapt to this. It makes it much better of a workflow to make your clinic more compatible with all of those out there in many different situations. We've actually seen that within 2 weeks on average of a clinic getting set up on Cortico, they are able to reduce their incoming booking volume and all of this by 70 to 80%. So this is why the online booking is an extremely important tool. And actually the Ontario, at least in Ontario, we have this program that the ministry is strongly advising, and the college as well. The different colleges out here, they're strongly advising that physicians set up an efficient booking system, because this is proven to increase access to care much more efficiently, and patients are actually more satisfied when they have this option as well. Lastly, on this screen, we have a brief overview on the right of different example workflows that a very big clinic, let's say, has. keep in mind, you can have as many workflows of these that you need. So do not be surprised how much you can have. So there's an example of a clinic that does COVID testing. They have something like 4 procedures and specialists, as well as different types of family doctor visits, and all of this can be easily accommodated. Once again, we're able to assist you directly. If you have any questions, please do not hesitate to reach out. We have the free 30-minute consultations available. I have 5 slots next week to go over this in depth with you one-on-one. Now, I'm going to just tell you briefly my experience with the clinic running on Cortico. It has been great because as a clinic manager, I've seen these different things happening that patients complain about that waste time when booking, or things that can just be made easier in the booking system, in the reminders, in the check-in kiosk. So actually, I've worked very closely with Cortico to implement a lot of different improvements and fixes to workflows to make it perfect for any clinic. Right now, actually, this has been the most accommodating booking system that you can get, but it's actually much more in depth than just this. These changes have an immediate impact on your patients and your staff. That's almost guaranteed that your staff will have much less burden for phone calls, so you can actually assist those who need it more. And of course, we have this very active feature request panel and feature improvement section on the website where users can submit and upvote different features that you would like. So we have an example on the right of this page. I'm pretty active in here, so a lot of what I comment has been attributed. And unfortunately, sometimes doctors get used to having a software provider that isn't really listening to their requests, such as a big company that they buy software from and they notice something, but they're not really able to see a change from their comments. Well, we've actually made it really easy to be able to submit your feedback and have it actually looked over by the real developers who work on this and others to make this a better product for you, because we care about how it works for your clinic. This is the #1 goal, to make it more efficient for you.
Perhaps Clark, if you could share a little bit about the pre-webinar survey results. We basically asked registrants which tedious task is slowing down your clinic the most. I've also got a poll that I've lined up here, but Clark, maybe if you could share some insight into the data that we've received.
Yeah, our group today is definitely a lot more cozy than the last one, which was at 9 p.m. EST. So that might have been a better time actually for people because they're not working either time zone. But yeah, I imagine with 14 votes, some of them would be repeats from our registration. So probably the same patterns will come through. It'll be interesting to see. So by far, that Adrian mentioned earlier, the two things that people wanted to address the most was phone volume, and also getting patients to fill out forms prior to the visit.
Well, let me trigger the poll because I'm really curious if I mean, we have 10 to 14 folks here, but I'm curious if you guys were to select one tedious task, which one would that be? I mean, in many conversations that we have, we typically hear that clinics face a range of different issues. But which is the most tedious that you face at your clinic? So a lot, we'll allot a minute for this poll. So about 25 seconds left.
These are things we hear about a lot, but if you have something that's not in the list, we'd love to hear about it in the chat or any other way you want to share.
I'll just comment while we're waiting. Someone asked about multiple doctors. If Cortico can accommodate this, of course, you can have as many as you need. My clinic, there's over 20, but I've seen clinic with over 40. So it's actually designed so any doctor can have their own workflow or own booking options. You can have it exactly as you need.
Perhaps, Jenny, if you could clarify in the chat if you meant multiple doctors specifically related to the kiosk. If so, that we can address that at the end, and I'll be happy to show a quick video of the kiosk in action as well. So let me close out the poll. And the results by inbound phone calls is the most, as followed by registering new patients. And then the other ones, appointment rebooking, uploading, downloading patient files and photos, and specialist referrals. So all of those are ways that we can help support. And I'll be happy to share some of my thoughts in the Q&A. We also have Ashley and Clark available to answer any questions offline as well. So why don't we continue on, Adrian?
Yes, okay. Cortico also offers this patient portal system, which is designed so that patients can click the link from their reminder email or the booking confirmation, or when an email is manually sent to them through the button here. There's a link. Curious if you can see this pointer. Okay, there is a button here. There's a button here to send them this by email, one by text as well. So by any means they get this, the patient is able to visit this patient portal, which has the map to the clinic, so they can see the directions. It has the time to their appointment. And when the doctor requests the patient to submit a photo for their appointment, let's say it's a virtual visit, or they're coming in, but they're coming in for some form that they need filled, or something that the doctor wants to see in advance, they can actually trigger this notification to be sent to them that says that the physician is requesting this and this from you. Please upload it through this secure link. And it's actually all HIPAA and PIPEDA compliant. It's automatically self-destructed after a period of time and encrypted. So this actually is much more secure than having this information emailed to the clinic or sending the patient an email and waiting for a response. It's coming from a trusted email that has a nice link for them to do this without any need to send any password or sign up. It's specifically geared to them, a one-time link. As well, this can have accommodations such as requesting forms from patients. So there's a button here. This is the provider view, what the doctor would see, or the MOA on the day sheet. So you can see that there's an option to assign them a new task. So the task can be a pre-visit form, such as when was your last this and this, or have you had this and this? Do you need something along these lines? Anything that can be customized by the clinic. As well, the doctor is able to join a virtual visit directly from the patient portal, because Cortico has its own, that's right now also certified by the Ontario eHealth. It has its own telehealth platform, because in September, starting in late September to October, around that time, most of the virtual visit codes that will be left, they're going to be required to be done over video, over an approved platform. Cortico is one of those. So the doctor can easily join. The doctor can easily join right here through this button if it's a virtual visit. So it's an all-in-one way to diminish repetitive questions from patients to collect their information securely. And also when they select a preferred pharmacy during booking, if you require that option, that can be configured. So they have to select a pharmacy from the dropdown. Then this will show over here as well, along with their pharmacy name, address, fax number, phone number, everything like that that you need.
Cool. Thank you, everyone. Thanks, Adrian. If you have any questions, feel free to put it into the Q&A section or into the chat directly. As you are inputting that, I want to talk a little bit more about the kiosk and answer some of those questions that Jenny had. So I'm going to share my screen again. All right. And I am going to switch to this view. Actually, I'm going to switch to this view here. So this is the kiosk in action, and there's actually a couple of options that the kiosk can be used. So in the demonstration that we have, it basically is set up as a check-in terminal. And so the use case here is that if a patient had already booked an appointment online, they're basically going in here, inputting their personal health number, their date of birth, and that basically then goes into the back end of your EMR and marks the patient as there. So again, it supports multiple doctors by default, because each patient would have booked an appointment with a specific doctor. So as they kind of go in and check in, then it basically alerts your staff that they're there. If you, perhaps even the doctor could come out and take the patient in. The other way that we talked about was sort of like a queue management system, where if the patient had not yet booked an appointment, they come into your clinic, they register themselves, and then they get issued a number. And so they can then go outside, take a walk, and not have to congregate at the clinic waiting area. So just sort of wanted to speak a little bit about that. And then to the other question from Dr. Singhal, there's a couple of options. And so the question is, when we tried listing the different types of appointments for each doctor, patients complained that there are too many options. Any thoughts? And Clark, feel free to jump in here. There's a couple of options. And first, I think where we demonstrate a lot of flexibility is by having your clinic website manage that patient flow. So in this demonstration clinic, like, we have the ability to list multiple locations. And then we also have the ability to have specific services within the context of your website. So you could basically use your website as the to flow patients specifically into those appointments, as opposed to going and just kind of go through the booking process, as opposed to just showing them the screen, which I completely agree could potentially be overwhelming for patients as they see. Clark, do you have any suggestions for Dr. Singhal?
Yeah, absolutely. So I think for a small clinic with no website, they're going to be using this, what Alfred just showed you, that little website that we generate for you. But for a little bigger practice that has more complexity, your website is really, it's the concierge to your clinic, and it's going to be the thing that explains patients. So based on your panel, what the types of things those patients are typically going to understand about their medical services, or what you want to ask. So if you're, and also if you're seeing a lot of appointments that are just, they're always the same duration, then you may not need to differentiate different services necessarily. You can just bill the patient after, say, rather than having them choose a sick note as the service, it could just be a walk-in appointment, and then you send them a bill after. And we actually automate that now, by the way, too. As of this month, there's a new feature to do post-appointment payments that'll be collected for you. So those are, I guess, my recommendations, is leverage your website like Alfred, and that can take a little bit of work to get right, and hearing from your patients and tweaking it a bit, but it's worth it, because then once it's going really smoothly, you just save so much time having to speak to every patient.
Yeah, I'd love to show a little bit about the payments as well, if we have a little bit of time. But to answer Dr. Singhal's other question, when patients upload a photo is there any way to add the patient's name to the photo itself so it will be easier to file? So I'm proud to say that our development team has made a lot of improvements in the document upload. I'll share two ways that we're doing this. So in the traditional called telehealth, we have the ability to create a patient portal. So I'm just going to quickly book an appointment. Actually, no, I think I have an appointment here. Actually, no, let's actually do a new one. And this flow is specific to a telehealth visit. There's going to be another option for non-telehealth visits later on, later in the demonstration, I mean. So I'm going to book for June 28th. I booked one already. Okay, so let's do June 29th. All right, so I booked the appointment from the perspective of the patient. So what we have here is we have the waiting room. If you haven't seen this before, this is our built in-house telehealth. And this waiting room allows the patient to click and upload a photo. So it could be, for example, like a photo of a skin rash, so that when the doctor signs in and comes onto the appointment, they can see those files. These files are actually then saved into the EMR under that specific patient. So there's no need to go to your Gmail inbox, download it, and then manually re-upload it. The other way that we have, and I'm gonna cancel appointment. The other way is the day sheet, which Adrian's demonstrated on his presentation slide. I'll go to June 28th, which is where I booked the appointment. Or was it June 27th? Can't recall. Well, let's use June 24th. So here we have the ability to assign a task. So this is now the view of the clinic staff, where perhaps the doctor might have created a tickler for them to request the patient send a photo prior to the appointment. Then the MOA would simply just open this appointment, and this then triggers an email to the patient requesting them upload the photo. And that, again, that photo is then attached to the patient's chart. Since we have a little bit of time, I also want to take the opportunity to show the payments. It's something that we've been working on, which we're very interested to get feedback. And I'll navigate back to the demo here. And I'll show you two ways. First is for private medical services. So in this particular workflow, we have the ability for the clinics to customize if they want to charge for a specific service. So in this case, it's like a COVID test flight, COVID test for flights. And so what happens is that when the patient goes through this booking process, it would then trigger a credit card collection form, which the patient will pay, and the money will then go into the clinic's bank account within 2 to 3 business days using our payment processor Square. The other way that we have, which is quite unique, is the ability to charge for no-shows. So as we understand it, traditionally patients who no-show are supposed to pay a no-show fee, right? $20, $30, $40. But often it's difficult for staff to collect that payment in person. So what we have now is for, I believe this is specific for Oscar. Clark, correct me if I'm wrong. I don't believe it's ready for Kuro. But for Oscar, if the clinic flags the patient as having a no-show, then what happens is that when they actually try to go through and book an appointment, I'm going to use a dummy patient that I have already, if I can, or it's automatically logging me in, right? Okay, no, it's not. 2, 3, 4, 5, 6, 2, 3, 4, 5, 6. I'm going to proceed to booking, and now it stops me. Now this is optional for the clinic, but this particular demo has made it so that a no-show fee must be paid off before they can book. So the patient will then click into pay your balance, enter credit card fee, a credit card number, pay the fee, and then they're allowed to book. So in the pilot implementation that we had at a clinic, within the first, I think, 3 weeks, they collected like 6 no-show payments. So that's another way where you can create a little bit more revenue without having to have that awkward conversation that your staff experience when they try to collect no-show fees.
Thanks. That's really cool, Alfred. I wanted to add that possibly even more important is your no-shows are going to drastically reduce when patients realize that they're going to have to pay, and there's no getting away with it. I think some clinics might think it's a little bit harsh, but at the same time, I think by making it really clear for patients, you're going to create a patient population that are, not going to waste anyone's time by booking an appointment and not showing up as well. So it's been extremely effective at getting the actual no-show incidence rate down really low.
Great. Any questions? Please do reach out to myself, Ashley, to Adrian. I'll put. No, this doesn't work. I'll put. Nope, that doesn't work. I wanted to put Ashley's email there, but that's fine. We'll send up a follow-up email with the webinar recording. Also provide a link to the YouTube channel where we have more content, and Adrian's contact information, my contact information, Ashley as well. So if you have any questions on how potentially the things that you've seen today can apply to your practice, feel free to reach out. We're more than happy to see where we can support some of the work that you're doing at your clinic. With that, then thank you for attending. It was a pleasure demonstrating Cortico for you. We welcome any feedback, and Upvote is where if there's any feature requests that you would like to see, sign up for an account there. I believe you need an account, Clark, correct me if I'm wrong, because we don't want people to randomly, just select one feature and upvote that. We want to hear from the community broadly. So please do check that, and we'll see you next time.
Thanks, everyone.
Thanks, everyone. Take care.